When is the last time you looked in your medicine cabinet? I mean, really looked in it. Odds are it's been a while. In today's Into Your Wellbeing, what you should be keeping in your medicine cabinet for a healthy spring and summer. Our expert today is Dr. Ashley East, the clinical pharmacy coordinator at Cone Health Community Pharmacy at MedCenter Greensboro. All right, I know a lot of people are thinking to themselves, the last time I looked in my medicine cabinet. So let's first talk about expiration dates. Should this be the guide to what you keep and what you don't keep?
I think expiration dates are a great starting place to determine what to throw out. It's certainly not the only factor that we think about, but I do think it's one of the most important. It is critical that people don't take expired medications, and that's for a couple reasons, really. One of the reasons is because over time, medications can weaken. And so while that may not seem like a big deal, if you're taking something that's just not going to be as effective for you, then really you're just delaying treatment. This can actually worsen the problem. So then you have a bigger issue than you even started with. But perhaps a bigger issue is that over time, not only are they weakening, but those ingredients can change and they can become more dangerous. So ultimately they can be harmful. So I think we kind of all think it's better to have something than to have nothing, and we hold on to these medications, but that something in this case can actually be quite harmful.
All right, and is that any different, the expiration date thing, when it comes to over-the-counter drugs versus prescription drugs?
Yes and no. I mean, ultimately, prescription drugs can be more harmful. That's why they are classified as prescription, which is why you have to go to the doctor, you have to get an order, and they kind of supervise you while you take the medication. But at the end of the day, they both can be harmful. So I would say you ultimately want to look at expirations on both of them.
All right, so let's talk about that. People are going to be going in their medicine cabinet after they watch that. They're going to be looking at all the bottles and things, and they're going to find a whole bunch of expired meds. So what do you do with the medicine that has expired, or you just don't need that medicine anymore?
Sure. So there's this really big misconception that you can just flush these or pour them down the drain. But unfortunately, our filtration systems are not smart enough to filter these out, the compounds out of the water, and they end up just contaminating our water supply. So ideally, you take these unused and unwanted medications to drug take-back programs or even medication disposal units. There are lots of these around our community. Lots of pharmacies carry them. There are many Cone locations who have these, disposal boxes, and you put them right in there and they're disposed of properly. We actually have a Cone website that directs you if you aren't sure of where to find one of these disposal boxes, and that address is just conehealth.com/drug disposal. There are several police departments and health departments, and again, your local pharmacies. So also feel free to reach out to your local pharmacist and ask them, where can I dispose of these medications properly?
All right, and are there any rules or do's and don'ts when it comes to using those medication drop boxes?
Absolutely. So we always recommend to remove your health information. Now, a lot of the boxes will say that you don't have to do that. And if the medication box says that you don't have to, then I would trust that you can leave your information on there. However, if you have the opportunity to go ahead and take off your name, the prescription number, your address, I would go ahead and remove that information just to be safe. You also won't be able to return syringes in medication return boxes. That is not allowed. You would have to contact Sharps to dispose of those properly.
Okay. All right. We're going to continue on talking about what you should do with that medicine cabinet and all those things that are in there, especially those expired meds. If you just missed it, don't be taking those expired meds, whether they are over the counter or prescription. We're going to be right back with the Good Doctor coming up.